So Carrie Lam this morning said we are facing some hiccups in the vaccination progress. She mentioned some troubles with each of the three vaccine candidates that we are having in Hong Kong. Can you tell us a little bit about what's the current situation? Are we lagging behind estimation?
Well, I think overall we're in good shape as far as the vaccination program is concerned. Um, First of all, the advisory panel has approved the first COVID-19 vaccine, okay, for emergency use in Hong Kong, which was then made official by the Secretary for Food and Health, and that's the Fosun-BioNTech NTech vaccine, and that is due to arrive probably towards the end of towards the end of February. I'm sorry. Okay, so it may be 1 or 2 weeks behind, but it's still manageable. So once it gets to Hong Kong, we would hope to start the vaccination program as soon as possible. So at least we have something on hand, okay? Now, there are two other vaccines that the government has announced. First of all, the Sinovac vaccine, okay, manufactured in China, and then the AstraZeneca vaccine in conjunction with Oxford, okay? Now, but these two vaccines haven't yet submitted all their specifications, right, to the advisory panel. So we haven't actually read them yet, okay, and I hope they do submit it, in the near future. And as far as the AstraZeneca vaccine is concerned, its due date for arrival it's towards probably in the summer, okay, maybe June or maybe July. So right now we are looking at basically the BioNTech vaccine will be the first one to be used in Hong Kong.
You said BioNTech vaccine will be about 2 weeks late. What's the reason behind that delay? Because Hong Kong actually signed the agreement pretty early on. How do they decide which country or which place gets the vaccine first?
Well, that you have to ask the vaccine manufacturer, okay? But I do recognize that there is a delay, not just for Hong Kong. There are some reports in Europe and even America that the supplies are not that stable for whatever reason. So, but the comforting thing is that the Department of Health people has checked with BioNTech and confirmed that the batch that they make for Hong Kong, okay, is on track. It's ready. Okay, so right now it's a matter of getting them packed, making sure the specifications are correct, and then getting them shipped over to Hong Kong.
Oh, so it's already all made. We only
Yes, the
need
manufacturing process has begun according to schedule.
has begun, not finished.
I'm not 100% about that, okay, because I don't work for the vaccine
Yeah,
company.
understand.
Okay.
You also said Sinovac hasn't handed in all the data they needed. How much have they submitted? Is there like an estimate of what else is needed?
I think one important component is the so-called phase 3 clinical trial data, okay, because we understand the Sinovac vaccine has been, under clinical trials in several countries, Brazil, Indonesia, perhaps Chile, and so on. So we expect they submit the complete clinical trial data, okay, with all the details included. Right now we only have bits and pieces, from officials in different places, but these are not, up to our scientific standard, okay, because our panel it studies science, okay, it has to look at the data concerning efficacy of the vaccine, its safety, as well as its quality. So there are a huge amount of data that we require for that purpose in order to approve it, recommend for approval for use in Hong Kong. Okay, so right now I think that's a crucial bit of information that is missing, and the same for AstraZeneca as well.
So what we know about Sinovac are from all the public releases from governments in their local trial locations. Did they ever submit anything at this point to Hong Kong specifically?
Now, I work for the advisory panel, and I only know when all the materials are ready. Okay, they don't submit the material to me. Okay, so I will be called upon. Okay, when the materials are ready, and the advisory panel convenes a meeting. Okay, So as to the various stages, you have to ask the Department of Health. Okay.
So is a public journal required for submission? If like Sinovac comes out and say this is our phase 3 data, and can the panel start to review it, or does it have to be published somewhere in a medical journal?
Well, I think the short answer is yes. Yeah, we do need a peer-reviewed process, basically, because that ensures the quality, okay, of the study. Okay, so that would be, the accepted standard, so to speak, unless there are some very unusual circumstances. But normally we do review, we do need something like a medical journal, a peer-reviewed journal, with all the methods, okay, and the results and all the details listed.
So there's really no way to speed it up unless they have that medical journal to present to Hong Kong. Like the experts here cannot just like start reviewing those sporadic data out there.
Well, of course they can submit whatever data they have. It's up to the Department of Health to determine whether it's up to the specifications that are listed in order to convene the meeting. That's what I mean.
Yeah. Okay. 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 So yes, and then this morning, Carrie Lam said she has already written a letter to Beijing to request some more China vaccines, and that's very likely to be Sinopharm. Is there any actions taken by the advisory panel on that front to also start reviewing Sinopharm?
We haven't got any information from Sinopharm at this point.
Yeah, got it. So yeah, and then like Hong Kong said it will order a fourth vaccine, and some local media said it will be not a Novavax. Did you hear anything about the upcoming deal to make?
Well, yeah. Well, all I can say is what government has announced. Basically, the government would try to purchase 4 vaccines based on 4 different platforms. So we have got 3 already. So, and the one missing is based on a protein-based vaccine platform. Okay, and any vaccine candidate that falls under that category, and satisfy all the requirements that we listed, will be eligible for review. And I cannot name any specific vaccine right now.
Can you share with us some logistics about when the Fosun vaccine arrives in Hong Kong, what will happen? We originally think the priority group will be elderly and health workers, but now we hear more cases from Norway. Is there going to be a change to that arrangement?
Okay. Now I think I'll take that in 2 parts. Okay. Once the COVID-19 vaccine arrives, most likely we will vaccinate persons who belong to the so-called priority groups. Okay, and the government has already announced what those priority groups are. They include residents in elderly homes or disabled homes, as well as their staff. And secondly, persons above the age of 60, and as well as essential service workers, however you define that. And of course, healthcare workers would be important as well. And then the third group would be persons younger than 60 years of age with chronic medical conditions. Okay, so these are the 3 priority groups that will be taken care of in the early stage. Okay. Now, concerning the elderly, we did discuss during the advisory panel meeting, okay, what impact it might have on the preparations. What I mean is that the reports from Norway that some elderly had died following the vaccination in elderly homes. But now this problem, I think, is largely solved because of the official announcement from the World Health Organization. I'm sure you know about that. According to the World Health Organization, the vaccine has nothing to do with those deaths. And then existing guidelines on safety concerning the BioNTech vaccine still applies. So I don't think the Norway reports will in any way, deter us from giving vaccines to elderly people. Of course, from a logistic point of view, we do have to plan very carefully. Okay, we may not vaccinate all elderly persons in elderly homes in one go, and the reason being that once they have got fever, a lot of times they may have to be admitted to hospital for observation, and we don't want suddenly a surge of elderly home residents going to hospitals. So we probably will take a stepwise approach in performing those vaccinations.
How is it going to be step by? Is it like just a part of the vaccines will go to elderly and more to other essential workers, etc.?
Well, first of all, we look at the priority groups, okay? So we vaccinate according to the priority groups, and elderly homes are certainly within the priority, okay? What I mean is, depending on the size of the elderly home in question, as well as how it's staffing, whether it has an environment that allows us to do vaccination, these are all important factors, okay? Because for some homes, we guess we need to have medical people go to those homes and do the vaccinations. So the visiting teams, so to speak. Okay. So for some other homes that are better staffed, and maybe they can, somehow we can work on an arrangement they can vaccinate themselves. But mostly, I think a lot of elderly homes in Hong Kong require these so-called outreach services. Okay. So we need a good plan in order to put everything in order.
How long do you think that step-by-step for elderly injection will last? Because if we see like Israel, they just really like rushed out everything and injected 40 doses for 100 people.
Mm-hmm.
So that's not something Hong Kong is going to do,
Mm-hmm.
right?
Well, I think we are in a situation of our own. Okay, right now our epidemic of COVID-19 is nowhere as bad as the States or in many European countries. Okay, we still got perhaps several tens of cases a day, but that's not unmanageable number in terms of hospitalizations and so on. So our prerogative really is to have an organized program. Okay, we try to do it as smoothly as possible because that's important to build public confidence. Okay, we surely don't want something unexpected or some logistic hiccup or we have to manage vaccine safety very carefully. So we will not be in a huge rush to vaccinate everybody at the same time. Okay, and we certainly won't follow the UK example of doing the first dose, putting everything on the first dose and then wait for the second dose to arrive. Okay, we'll do things according to plan and according to step. As to how long it would take to vaccinate all the elderly, I don't think I can give you a good number right now because it really depends on how they're forthcoming to get vaccinations. Okay, but we'll monitor those numbers, and I'm sure the government will announce those numbers periodically, perhaps even on a daily basis at the beginning of the program, so that we know how far we are progressing, and up to a certain stage, perhaps we can also open the vaccine to other groups, other priority groups, and further down the line, perhaps to the general population as well.
Yeah. And the Pfizer vaccine really needs very cold temperature. Is Hong Kong equipped logistically to handle this challenge?
Okay, yeah, it has some it introduces some complexities, but it's not in any way unmanageable. I think the government already has a good plan to manage that. Okay, so as you said, the BioNTech vaccine requires for prolonged storage an ultra low temperature, somewhere near minus 70 degrees Celsius. Okay, but Hong Kong, there are logistic companies that are capable of storing the vaccine under those temperatures, so no problem about that. The next challenge, of course, is the transportation. Okay, how to take those vaccines from the ultra cold freezers to the clinics and to the vaccination centers. And for that, the logistics company will take care of that, transportation process. And then once it reaches the clinic, it will be put in a normal refrigerator. 2 to 8 degrees Celsius, where it can stay for a maximum of 5 days. Okay, so we will plan each step according to the requirements of the vaccine to make sure that we don't inject vaccine, that is, outdated.
Or you go outdated without injection.
Mm-hmm.
So I heard that like Pfizer, because the Pfizer-BioNTech vaccine is hard to contain, so it will be done in government centers, and then if Sinovac comes, it will be in private clinics. Is that the current plan?
Right. Basically, as you said, we plan to deliver the BioNTech vaccines primarily in the community vaccination centers. Okay, so we plan to have one center under each of the 18 districts in Hong Kong, and that will be a big center that can take care of up to maybe 2,000 or more patients a day. Okay, so, and either the government will run the center, or government may contract out to an operator to run the center. So, and the center will provide only the BioNTech vaccine and not other vaccines, because we don't want mix-ups. Okay, all right. Now, as for private hospitals, private clinics, and so on, I think if you look at the vaccine properties, it would be easier for them to handle the other vaccines, like the Sinovac vaccine or the AstraZeneca vaccine, where the storage temperatures are just like many other vaccines. So for that step, they are more suited for those kind of vaccines. Now, we are still debating whether some BioNTech vaccines can also go to private hospitals. So that remains a possibility, but we need to think, you know, think all the dimensions, you know, how they're going to deliver and so on. But that's basically the scheme. I mean, a BioNTech will be at the community vaccination centers, and then the other vaccines could be provided by the private sector.
Avoid mix-up, meaning getting a shot from Sinovac, another shot from Pfizer?
Yes, basically, yeah. We just want one type of vaccine in those centers.
How is the 7.5 million BioNTech shots coming to Hong Kong based on the current schedule?
Okay, they will come in batches, not just one whole lot. Okay, the first batch will consist of 1 million doses. Okay, and then after 1 month, the second batch will come. It's either 1 million or 1.5 million, and so it will come in a few batches. And the reason it's we don't want to overburden our storage facilities, and we want to equalize the risk. Okay, suppose there's problem with one batch, okay, then it won't affect other batches. So that'll be, from a logistic point of view, a safer approach.
Understand that. So, like, is there any agreement on, like, maybe every 2 months we get 1 million, etc.?
Yes, there is already a schedule worked out. Yeah. So it basically will arrive every month, and the number of doses will depend, is either 1 million or 1.5 million.
So actually by mid-year we will get all the BioNTech vaccines.
Right, yeah, that's what I suppose.
Yeah, understand. What if, like, there's a strong demand for BioNTech vaccines? Do you think there's a chance they can increase either short-term or long-term supply to Hong Kong? Especially now we don't have Sinovac.
Okay. Now, I'm not sure, okay, I can't answer that question. Surely, I mean, there can be discussions with the vaccine company, you know, whether they can increase their supplies and so on, but that would be a dialogue between the government and the vaccine manufacturer. And that also depends, of course, on the uptake rate of the vaccine.
How's the government going to monitor the side effects?
Okay, now, according to what I know from government, they're going to set up a special group to look at that matter, the so-called adverse events following immunization. Okay, so basically, if there is a serious health event that happened after the vaccine is given, whether or not it is related, okay, so that event will be reported to this expert group, and then the experts will look at all the circumstances, the medical histories, the vaccination histories, and then the current illness and so on, and try to determine whether the vaccine has anything to do with that particular health event. So that's, you know, one of the ways of doing this. There are other ways, of course. The government will also look at the hospital data, okay, and compare and see whether certain events, you know, are more likely to happen or happen more frequently following vaccination than others. That may give us another kind of signal. And it is in collaborating with the local university, the Hong Kong University, in doing that project. So there are a couple of ways we can manage or monitor adverse events, okay? And of course, the most important thing is the public communication. Because once such an event occurs and it's widely publicized, then a lot of people, you know, will hesitate to get the vaccination. They want to know what exactly happened before they decide whether or not to receive the vaccine. So this group is very important in allaying those kinds of concerns.
Yeah. So actually the first government group will be the patients themselves. If they feel uncomfortable, they can go to the government, and the other side will be a general monitoring of the hospitalization in Hong Kong.
These are just two ways of the so-called monitoring system, okay? And there are other ways, like monitoring elderly homes. If you have some elderly home residents getting vaccinated, you can ask them to ask the home to report any following sickness, for a certain period after the vaccination. So that's another way. The sentinel centers can report the health events.
Yeah. But so far we are seeing the efficacy rates of the vaccines are widely different, right? What if citizens prefer a vaccine and then another one is just left aside? And that will have two effects. One is that you run out of storage, another one you pile up and expire. Is there a way that government or the advisors are going to handle this situation?
Mm-hmm. I think aside from vaccine contraindications, okay, basically a person can choose to receive the kind of vaccine that he or she likes, okay? If I want to have the BioNTech vaccine, I'll go to the community vaccination center. If I want to have another vaccine, I probably will go to the private sector, okay? And it's free of charge in both cases, okay? So there may come a situation where certain vaccines are used more than others. That certainly will happen. But I think because the government really has put an order of 7.5 million doses for each type of vaccine, so that's a huge amount. Okay, so I think even if that occurs, it will occur in a later phase of the vaccination program, probably months after the program has started. Okay, so by that time we'll have a good idea. Okay, and if certain vaccines we think we need to replenish, okay, then steps can be taken to do that. So I'm not too worried about that kind of situation because it won't happen on day one or in the first month.
Yeah. If we don't use up the 7.5 million, is there a penalty?
Not really. Yeah, actually, we expect some vaccine wastage in a sense, okay, because if we purchase 4 types of vaccines, each of 7.5 million doses, that ends up to cover more than 10 million Hong Kong people, all right, and that's more than the entire Hong Kong population. So there will definitely be some vaccines that are not used, but for the sake of health of our population and also to get our lives back and get the economy started again. So I think that is, that is understandable.
Yeah, do we need to pay for that if we don't use it?
Oh, actually, the government has paid for all the vaccines.
I see.
Yeah, and as I said, it's free no matter where you get a vaccine.
Okay. Yeah, but the Hong Kong as a whole need to pay for the actual vaccines.
Yes.
Got it. How does the government going to boost the acceptance rate? Because CUHK did this research, and then they found only 37% of people are willing to take the vaccines, according to survey back in summer.
Yes, that's the biggest unknown, I think, at the moment. Different surveys came up with wildly different results depending on who they ask and how the questions are structured. But I think you won't know the answer unless, the vaccination program goes on the ground and gets started. And it will be easily influenced by sudden events like, adverse events following immunization and fake reports, rumors and all that. Okay, so definitely we're in for a wild ride in that sense. So people's sentiments will fluctuate. But I think the important thing is once you get these events, these reports, these rumors, if you confront them right on, you don't wait, and you clarify, all the questions, all the problems as soon as possible, okay, public confidence will come back. And then the Norway reports are a case in point, okay, after the WHO report, then I think no country has stopped the vaccination program because of the Norway report. Okay. So once we do that, I think people will start coming back and get the vaccines because it is for the benefit. It's not just on the health side, it's also for the daily life in a lot of cases, okay. If I'm an employer, I would certainly like my employees to get vaccinated, okay. If I work in an elderly home, of course, I should be vaccinated because otherwise I will pose a danger to the elderly residents, right? So there are definite pluses for vaccination, and I think there are good incentives for people to get vaccinated. Of course, I cannot predict at the end of the day what the uptake rate will be, what the coverage rate will be. Okay, but as I said, we'll monitor the vaccination uptake along the way very closely and see if there are any gaps and try to fill those gaps.
Sidetrack, because when government announced the approval yesterday, it says it's still requesting data from Norway and Germany for clarity. So even after WHO clarification, is there going to be more exploration on that issue going forward?
I think that won't hurt to get more information. Okay, after all, if government has already asked for that information, then the vaccine company, the vaccine manufacturer, would likely provide it. Okay, and of course the WHO report would be, a bonus. It would be a good thing because it's very authoritative. It comes from the World Health Organization, but we will also look at some other sources of data if they're available.
Is there any chance Hong Kong can do any local production of vaccine?
I understand some universities are working on that, thinking about that. It's a huge endeavor, of course. It's an entirely different thing. Doing a laboratory, develop a prototype vaccine, compared with you have a big manufacturing plant for mass production. Totally two different scenarios. And I think for me, my personal view is Hong Kong has the research capacity to do vaccine research very well. And indeed, we have a lot of very distinguished vaccine scientists. But what we need to solve is the mass production, because that you need a market. Okay, if you put up so many vaccines, you need a market to take on those vaccines, and Hong Kong's population is limited. Okay, we're not like mainland China with a huge population. So, I think from a commercial point of view, that is a major stumbling block.
Yeah, if we use the not mandatory, it's like the voluntary testing, citywide testing last year as an example, that only had like 2 million people, not only a lot already, 2 million people testing, but then to achieve some kind of stable immunity, we heard like Sinovac this morning saying they want to make it like 70 or 85%. Is that a goal that's achievable in Hong Kong, in your view?
Mm-hmm. Well, as far as I know, the government hasn't really set a goal, a percentage of how much we will view this as a success or whatever, because there is so much unknown. We probably need to, as I said, roll it out first and see what happens before we come up with some concrete idea of what target are we going to make. Okay. Now, of course, a vaccination uptake rate of maybe 80% is a tall order for any country, I would say. And you also have to bear in mind that there are certain people who cannot get the vaccine. For instance, children, okay, they are not appropriate target for the vaccination. Okay, so so to achieve herd immunity, you really need a rather high percentage of population covered. Okay, but on the other side of the coin, though, vaccination is a very important way to manage COVID situation, but it is not the only way. Okay, the social distancing measures, face masks, okay, contact tracing, quarantine, they all add up. Okay, together with the vaccination to control the whole COVID situation. So we're hoping that in combination, they will, reduce the case numbers in Hong Kong, hopefully, suppress it to almost, single digit or perhaps even no case for a certain time, okay, so that our lives can go back to normal.
You mentioned social distancing will be working on addition of the vaccines. After vaccines are introduced, when can we take off the masks? Mm-hmm. Do you see a day like that coming back?
Well, I think that day will happen, yes. It will depend on how the epidemic pans out, okay, mostly, all right? If you look at mainland China, or even perhaps in Macau, Taiwan, they did an excellent job. And a lot of places are COVID-19 free for an extended period, okay? So Hong Kong is not, nowhere near that level, but we're not doing very badly. I think we still haven't got a very major situation that is out of hand compared with many other countries. Now, the mask wearing is still important in the sense that at the beginning of the vaccination program, you don't have a lot of people who get vaccinated, okay? So in order to prevent transmission, you still need to put on a mask. But when there are lots of people who are vaccinated, when the herd immunity builds up, the virus is unable to transmit efficiently in a sustained way in the population, then we may consider, relaxing the mask mandate or some other, requirements. The first things I think that could be relaxed probably are the social distancing measures. Things like the restaurants are not allowed to open, after 6 o'clock. I think once the case numbers come down, that particular requirement could be relaxed somewhat, okay, like what we were at the beginning of the epidemic, okay. So it will come bit by bit, okay. Won't get our normal lives back in an instant like that, but it will come gradually and hopefully for the best.
The virus variants in South Africa really raised the alarm that the vaccines may not be able to also prevent some mutations in the future. How big is that concern?
Mm-hmm. I think that is the virus mutations. Definitely, we need to monitor very closely. It does have the potential to weaken the vaccine response, so to speak. Okay, and that's why the scientists and the vaccine companies are running all kinds of experiments, trying to determine whether the vaccine is still effective against those mutants. And I do know that Moderna just made an announcement saying that it's still okay, although South African strain may pose a little bit of problem later on. Okay, but even if that happens, I do expect the vaccine companies can make another vaccine. Okay, based on the same technology. They just take the mutant. It's somewhat like influenza. Seasonal influenza, you need to get an annual shot because the virus mutates every year. Now, I'm not saying that we need a COVID-19 vaccine every year. We haven't gone to that stage yet. Okay, but if the virus does mutate to a certain point that the vaccine no longer works well, okay, then maybe we need to revise our vaccines. Okay, so but we need to do first things first. We haven't even got the vaccination program started yet, so we'll make sure that it starts properly, it goes safely, people accept it, and then we'll look for other, things like virus mutations and all that.
Do you think in half a year we can cover most of the high-risk people?
That's certainly our hope, yes, because those priority groups are at the most risk of complications and deaths from COVID-19. Okay.
Oh, that's just a very arbitrary number, like half a year. Like, would it be even shorter? Any hope for even faster coverage for high-risk people?
Mm-hmm. Well, I think there are enough vaccines to go around. Okay, the question really is community acceptance of the vaccine. There is no mandatory law in Hong Kong, requiring people to get vaccinated. So we have to explain to lots of folks the benefits of the vaccine. Not just to you, but also to people around you, your friends, your family, and so on, so that they understand and they come forward for vaccinations.
We have seen government response evolved a lot over the past year. Firstly, like mandatory testing was introduced, and then now we have these like regional small lockdowns targeting testing. And then now we have vaccines. What will be some other measures the government will consider to introduce to more effectively and innovatively curb the virus spread?
Okay. Now, my capacity really is to advise on the COVID-19 vaccine and not on the overall epidemic itself. So I'm not in a good position to answer your question. But in a general sense, I think the government has done whatever is necessary, to curb the COVID-19 epidemic in Hong Kong. Okay, and it takes some time, for things to work out. For instance, at the start, we don't have enough laboratory capacity to test. Okay, so you can't test the whole building, residents, on day one. Okay, but right now we have that capacity, and the government is implementing those extra measures, and I do expect they will review the measures and then perhaps strengthen some measures along the way, according to the epidemic situation and according to our capacity.
Mm-hmm. Can I quote you in saying that your hope and maybe the government's hope is to finish vaccinating all the high-risk people within half a year. Is that correct?
Well, that's my personal hope.
Yeah, okay,
For
I'll say
on the part of government, as far as I understand, we haven't set a target, as I said, whether in terms of the coverage rate, number of people getting vaccinated under a certain specified time frame. No, that has not been decided. But it's certainly my personal hope that we will get those priority groups covered as soon as possible, maybe not even half a year, maybe hopefully, less than that.
Actually, till now, we don't have enough scientific evidence to prove that the virus transmission can be stopped by vaccines. We only know it prevents serious illness. How does that? What's the implication for that? If we can't really achieve any herd immunity, like even if you got vaccine, you can still threat.
Right. The matter can be looked in two ways. Okay. Now you're right in saying that we do not have a very definitive idea or a definitive data to show by how much the vaccines are able to cut transmission, especially silent transmission from asymptomatic persons and so on. But we are not totally blank. In the AstraZeneca vaccine trial, it does show that the vaccine seems to have some effect on curbing or reducing transmission. Okay, but because the vaccine, the trial is not primarily targeted at measuring that measure. So we need further studies, basically. And I don't think that is a very difficult job to do, okay? And I'm hopeful that in the coming months we'll have a better idea, okay? But simply from a biological point of view, we do expect the vaccine, even if it is not 100%, effective in preventing transmission, it has to do some good, okay? The matter really is how much.
It's interesting because talking about innovative methods, my colleague in Beijing are seeing like China doing some anal swab to make sure even like those people cannot be tested out by like nose swab can be detected. And then it's really interesting to us. We never heard of this kind of test before elsewhere. Do you think there's some like value in doing that? Is it necessary, or would it be like over testing?
Well, as I said, it has nothing to do with the vaccine, so I'm not really the expert to comment on that.
Okay.
I think that the rationale probably is because the COVID-19 virus, the SARS-CoV-2 virus, is also excreted in the feces, so it's possible to take a rectal swab. Okay. Now, but it really depends on what you do about it, whether you're doing it for patient diagnosis, whether you're doing it for an epidemiological investigation. So it is for very different purposes. And how effective is this kind of sampling for each of these purposes? We need some scientific data to answer those kinds of questions. Okay? So for the time being, I think for Hong Kong, the deep throat sputum as well as the nasal swabs and the deep throat swabs will be, primarily, used for diagnosis as well as for testing of contacts and so on. Now, I should also add that recently, sewage samples are also tested. Okay? It's not anal swab or rectal swab, sewage samples, which are composite, okay, samples from many people. Okay, and it looks like the value is on trying to locate buildings or locations where there are certain people who live in those buildings that excrete the virus. Okay, so the preliminary results seem to work. Okay, and I know that government is progressing along those lines. Okay, it would be nice to have a detailed study showing all the data and the effects, and whether we can use this as a reliable tool to as one of the ways to monitor or control COVID-19 epidemic in Hong Kong.
I actually see some local media saying Sinovac offered to ship some vaccines to Hong Kong last month. No, still this month, January. Yeah. So is that the case? So the Sinovac issue is really not about their supply, right? It's totally about their final data review. It's not submitted.
I have no personal knowledge about the supplies. Okay, but as I said, any vaccine, COVID-19 vaccine that comes into Hong Kong, if it needs to be approved, it has to go through the standard process wherever it comes from. Okay, And as I told you, at this point in time, we only have the Pfizer-BioNTech vaccine that has undergone that process.
Mhm. Right. Is when you are designing the rollout program, is political issues a concern? Like whether people are concerned about origin vaccines in China or anything else like that? Would you do something to promote the vaccines in a way that can persuade people with different political stance?
I think, as scientists, we don't really consider such as politics, okay? But community attitudes are important, okay? As a general rule, the so-called KP, the knowledge, attitude, and practice, okay? We need to understand why people take the vaccine and why people don't take the vaccine, what are their concerns, what can motivate them to take the vaccine, and so on. So there is a standard science in answering those kinds of questions. And if where the vaccine comes from is one of those factors, then we will consider this as well. But it is not from a political sense. It's just the way the science is done. Okay, we need to address public concern, their perceptions, in order to have a successful program.
Yeah. Do you envision more people to go to the community centers and more people to the private clinics? What's the divide between where people will go? Like how's that working out?
Well, I really can't tell because there's no data right now. Okay? I don't think there's any good survey out there um, measuring, how many people will go to, whatever locations, and that again will change very easily with time. Okay, so I think our game plan really is to get those centers going, set up those centers, get this program started, and then monitor all the way. And if there are some, as I said, some gaps in between, then we'll fill those gaps. Okay, so I don't think speculative answers are useful because they're always wrong.
How do you? I will have this last question, and then Josie, if you have anything to drop in. I want to have a sentence to describe the pace and the mood right now in the government in terms of rolling out the vaccines. Is it?
Well, I think there is a lot of enthusiasm in government to get the vaccination program started because that is a very important tool, a very important weapon, so to speak, in our fight against COVID-19. Hong Kong people has gotten through this for over a year now, and we're tired of the epidemic, and we certainly want to get our lives back. We certainly want to save lives as well. So the vaccination program will give us a unique chance and a very good opportunity to do that. So we are determined to do the best we can and get the vaccination program going.
Okay, can I ask what are the challenges of launching such an extensive vaccine program in Hong Kong, which is a city that is densely populated? It's very close to China, which is a very big country, when people can still get in, like cross the border and come in. And also, as like you guys have mentioned earlier, there are political situations in Hong Kong. Like a lot of people trust the government, and also a lot of people don't trust the government. So, as an advisor, what are the challenges you have faced when you're rolling out this program?
I think this has a few sides in terms of new challenges. First of all, the scale of the program. It's unprecedented in its size. We're talking about the entire Hong Kong population. Okay, so potentially 7.5 billion people can come forward. Okay, so that translates to we need some very good planning in terms of where those vaccination centers are. We need to get enough medical people to operate them, to give the shots, to monitor side effects, and so on and so forth. So that's a huge population. The second challenge is, because this time we're not using just one vaccine, potentially 3 or even 4 vaccines. Okay, so that adds another layer of complexity to the whole thing. Okay, because the different vaccines have different properties, and some need to be handled in a different way. Okay, so that's why we need a very large planning group, a task force, to make sure that all those aspects are in place. And thirdly, I think another unique feature of this program is we build an information system to support the program. Okay, so it's important for people to make an appointment, to get the vaccination cards, to have their vaccination record entered in a computer. Okay, to manage the whole process. generating statistics and telling us how many people get vaccinated every day, what is their age composition, are there certain groups that has fallen out of the radar. So we need a whole new information system to manage that, and that is being built specifically for this program. So in a nutshell, I think there are some unprecedented challenges on this program due to the factors I mentioned to you. But on the other hand, we also have the commitment. I think the government is very committed, as I said, to run a successful program. And so we will do our best, and I hope that the community will also be receptive, and we won't need to work together to get over this.
You said there will be a system to track the information. Is there going to be a COVID immunity passport like those in Israel?
There will be a vaccination record for sure. Okay, if I got my shot, I will be given a vaccination record to prove that, okay, on this day, I got this vaccine at what location. Okay, and you can use this vaccination record for whatever purpose you want. This record can also be stored in your cellular phone if you like. Okay, so whether it's an immunity passport, it depends really on how you use it. But right now, we'll definitely will be providing a vaccination record.
Is there any kind of like perks the government will give to people that are immune to the virus? Like for example, like Israel, if you travel and you come back and you have vaccine, you can be quarantined for less time.
I think those kinds of considerations will come at a later stage as to what we do with vaccinated people or non-vaccinated people or whatever. Okay, there are a lot of considerations that go into this, and we need to make sure that everything is done in a fair and equal way. Okay, while also giving some incentive and trying to make things easier for people to get back their normal lives. Okay, so, but we need to start the program first. Okay, before we think about those other issues.
I saw you said on media yesterday that the government is chasing Sinovac to provide the data, right? So there's really like this kind of chasing. I thought they should be more proactive.
Right. So that would be the last question I take for you. As far as I understand, the government has asked Sinovac, to provide the necessary data in order for the advisory panel to convene. Okay. I don't know whatever reason. We still haven't got that because the phase 3 clinical trial results have not yet been published. So I would imagine that they need some time to analyze or to organize the report in some ways. Okay, so but the trial has been done, and I think it was just a matter of time before they publish it.